Today, if we're seriously ill, we expect to be treated in high-tech hospitals with sophisticated surgery. But in the past, surgeons didn't work in hospitals, and surgery was rarely used to cure disease. When did things change? Surgery has existed for thousands of years, but in the past, it was usually only used in emergencies. Generally, surgeons only carried out certain types of operations, most of which had been on the surface of the body, cutting off diseased parts of the body, and drilling holes in the skull to relieve pressure. Bleeding was the most common surgical procedure. Some people liked to be bled regularly because they thought it was good for them. But almost any other surgical procedure was likely to end in death. So doctors avoided surgery. Generally, they tried to treat the whole body by prescribing medicines, diet and exercise to get it back into balance. They did this because they thought disease was part of the whole way you lived your life. What you ate, where you lived, what work you did, and what kind of person you were. This kind of medicine continued right up until the 19th century. But by 1840, this way of thinking about illness became less important. Surgery began to take over. It was seen as the best answer for many medical problems. The surgical point of view was that illness was not about the whole body, it was just about specific bits. If you had a lump or a growth, it was because there was something wrong with that particular part. The way to treat it was to remove it. You didn't need to look at the whole person, you just needed to remove the problem. In the 19th century, the sources show us that people were beginning to choose surgery rather than drugs or herbal medicines. This is the case of one of those people, a young working-class woman referred to in her notes as Elizabeth P.
When I was 9-year-old, I fell and cut my knee, and it became infected. It became so bad they feared it would spread. They must cut it off. Cut my leg off above the knee. So they held me down, and my father had his hand tight on my mouth, and the surgeon took his saw. And I remember the feel of the saw. The air on the open flesh, like sharp forks, and how the flesh snagged on the saw. And how surgeon tired, mopped his brow and swapped saw from one hand to the other and then began his work again. That were 14 years past. But the wound never healed. I cannot remember a time I've not felt pain in this stump. Like pins. And it's disgusting. It's grown a mass. A knot of skin, white like bone, but covered in fungus, which when you touch it is very tender and oozes, and it hurts. And so, though I know what it is I ask for, I want them to take off what's left of my leg.
Elizabeth's case is important for two reasons. First, because she chose surgery, though she didn't have to. Her illness wasn't life-threatening. Second, because she was poor. Surgeons were treating more and more working-class people.
They've been very kind at the hospital. My consultant is Mr. William Sands Cox. He's a gentleman. When he examines me, I do not feel any shame. For 2 years, he's prescribed other treatments. Dilute nitric acid, nitrate of silver, iodine, nothing. We discussed it. He said, have you asked your friends and your family? I said, they're for it. He said, there will be pain. I said, I know pain. He said, will you take a drink? I said, I do not drink. When time comes, I will sing hymns and Lord will be with me.
There were no anaesthetics at this time, so the operation was performed with Elizabeth fully conscious on November the 1st, 1844. In the medical newspaper, The Lancet, William Sands Cox described its progress.
At 11:30 a.m., the point of a narrow double-edged knife 12 inches in length was introduced at an inch below the anterior superior spinous process of the ilium and carried across the neck of the femur parallel with and a little below the Poupart's ligament beneath the muscles of the anterior region of the thigh.
In fact, it takes longer to describe the operation than it did to perform it.
The operation was completed in under 35 seconds. All the blood vessels were secured in under 5 minutes and no more than 4 ounces of blood were lost.
3 months later, the wound healed. Elizabeth was at last discharged from hospital. The operation Elizabeth had would not have been done 50 years before. It was possible now because of the increased skills of the surgeons. Before the 19th century, surgery is seen as a savage procedure. In the 19th century, we see many more images like this, showing surgeons as gentlemen. By 1845, surgeons were very skilled and very confident. Part of the reason for this was the Industrial Revolution, which meant that for the first time, there were much greater numbers of poor people living in the big cities. In the past, people like these had lived in the countryside and relied on magical cures, herbal medicine and wise women. They'd not usually been treated by doctors or surgeons. Now there were many more opportunities for surgeons to practice and to get jobs in hospitals like this one, set up with charitable donations for poor working class people. It meant more jobs for surgeons, but because these patients were poor, the surgeons were more powerful and could experiment. This helped them to become more important in the medical profession. The Industrial Revolution also meant better instruments and new ways of working for the surgeons. For thousands of years, surgical instruments had stayed the same. The kind of instruments used by the ancient Romans would be recognised by any surgeon even today. But in the 19th and 20th centuries, surgeons created many new devices that helped them to carry out very dramatic new operations. 1816, the stethoscope. 1870, the steam carbolic spray. 1895, X-rays. They could now begin to go deep into the body, developing anaesthetics to lessen the pain of operations, antiseptics to keep the wounds clean, and methods of preventing blood loss to stop the body going into shock. By 1922, Harvey Cushing was carrying out successful operations on the brain. He sawed through the skull and used hundreds of clamps to keep blood vessels closed. They were made of steel, so they were sterile. He deliberately used all the methods of working in a sterile environment, using a special room instead of a public hall, using clean clothes for all the doctors and nurses. He even insisted on no unnecessary talking in the operating theatre, as he believed it spread germs. This film was made in 1931. By this time, Cushing was carrying out his 2000th brain operation.
The operations often lasted many hours. As the after effects of deep ether anesthesia over such a long period could be severe, Cushing worked with a local anesthetic with just enough ether to keep the patient unaware of what was going on.
This rise in the ability of the surgeons was very closely linked to the rise of hospitals. Medicine was moving out of the home. More and more of it took place in the big hospitals in the cities. By 1922, hospitals and medical care for ordinary working class people was very well established. The 1911 National Insurance Act meant that far more people got medical treatment. Poor people joined friendly societies and insurance schemes so they could pay for their medicine, and there were still charitable donations from rich people. Many hospitals made fundraising films such as this to encourage people to donate money. This reconstruction is based on the hospital records of one of those hospitals, Charing Cross Hospital, for one day in 1922. The drugs available were not very different to the herbal remedies used for thousands of years. The hospital surgeons also still used ancient surgical methods. Leeches were used to bleed patients, sucking out blood to relieve high blood pressure, and cupping was also used, putting hot cups on the body to draw out poisons. But more and more people were being treated in the hospitals, and surgery was becoming more common. 26 years later, when the National Health Service was set up, the use of surgery as a treatment for ill health became even more widespread.